Critical Thinking and Coding Tips for Chapter 19. Okay, our first critical thinking question. How is arthritis as a late effect coded? Our answer. In most situations, the residual condition is coded first, followed by the late effect for the cause of the residual condition. So if arthritis is the resulting late effect, it's coded as a principal diagnosis and the etiological condition is coded as a secondary diagnosis. Next question. How is spinal stenosis coded? In our answer, there are two different kinds of spinal stenosis. Spinal stenosis can either be congenital or degenerative, which is arthritic. As stated in the congenital chapter, it's important to determine whether the condition, in this case spinal stenosis, is documented as congenital or degenerative. If the stenosis is stated as degenerative, use a code from the category 722. However, if congenital spinal stenosis is documented, use categories 723 through 724. Remember not to use these two codes together. Okay, and our final critical thinking question. What is a pathologic fracture and what are the dilemmas with coding these? Our answer. A pathologic fracture results when a bone is weakened by another pre-existing disease. It's important to understand the differences between a traumatic fracture and a pathologic one. A somewhat minor trauma can cause a pathologic fracture, but the bone would not have normally fractured unless there was an underlying disease that caused the bone to be weak. In this case, a pathologic fracture would be coded rather than a traumatic one. Some underlying causes of pathological fractures include osteoporosis, bone neoplasms, Paget disease, or any other condition that might compromise bone strength. Those conditions are to be coded as secondary diagnoses with the pathologic fracture coded as the principal diagnosis. Okay, here are some coding tips for this chapter. I do want to bring your attention to one of the most important parts of Chapter 19 is reviewing the breakdown of the fifth digit subclassification explained in Figure 19-4 on page 532 of your text and is also located in your code book. You will need to refer to this breakdown, particularly the location of the knee joint, in the workbook assignments for correct fifth digit assignment. Now, the easiest way to look up the diagnosis code for a herniated disc is to begin your search in the alphabetic index to diseases and injuries with the term displacement, intervertebral disc, continuing by location of the spine. Now, coding orthopedic procedures. It's important to review the operative report before assigning a procedure code. Aspects of the operative report that would be needed for correct procedure coding would be the approach, such as open versus arthroscopic, and the sites, and the incision versus excision, and the revision versus replacement. Okay, continuing on with some coding tips. Different types of arthritis and how they are coded. There are more than 100 different forms of arthritis. Arthritis can affect multiple sites, such as joints, muscles, connective tissue, skin, or internal organs. The most common forms of arthritis are osteoarthritis and rheumatoid arthritis, but because there are so many various types, it's important to review the record in depth to determine if the type and/or cause of the arthritis is documented in the record. Often, an orthopedic consult can be helpful in narrowing down the type of arthritis. Not only is the type of arthritis important in determining the correct code, but the site of the arthritis will also help determine the arthritis code. This can include one or several joints, which changes the fifth digit of the code. Okay, causes of secondary osteoarthritis. Now, some factors that contribute to secondary arthritis are obesity, trauma, congenital abnormalities, scarring from previous inflammatory disease, or circulatory bone disease. Secondary osteoarthrosis should be coded with a second code to describe the injury. disorder or disease that caused the osteoarthritis. Okay, now how to code a partial hip replacement removed and a total hip replacement put in. As per Coding Clinic Assign 815.53 Revision of Hip Replacement. This code includes a total or partial replacement and indicates whether the initial replacement is replaced or revised. Now, how osteomyelitis is diagnosed and treated. An aspiration of the bone might be done to culture and confirm the pathologic agent. Blood cultures may be positive, which would indicate acute osteomyelitis. Bone scans can be useful as well. Once osteomyelitis has been confirmed, it can be treated with long-term antibiotics and surgery to incise and drain or remove severely damaged bone. When coding osteomyelitis, it's important to know whether it's acute or chronic, what the site is, and if the etiology has been determined, such as diabetes.